As you know, the philosophy or the spirit behind goalkeepers is to be in a position where we allow decision makers to get a sense of where we are in trying to get into our sustainable development goals. And then that would inform decision making. But we felt that this time, given the impact from the time the pandemic hit and where we are at this point in time, what the damage has been. And there have been a lot of other things that we've looked at. When you look at basic immunization coverage, which is really critical, it has gone from 84% to 70%. This is a setback that we've noticed just in 25 weeks. It's a setback that for something that was built in 25 years. But there's another theme also which is very important, especially going back to your first question about the key themes. One of those is just inequality. It has reinforced the fact that we actually live in an unequal society. And then when these pandemics also hit, they disproportionately tend to affect those who are the most vulnerable, including girls and children. The other theme that we also highlight is that despite the difficulties that many of these countries have faced under COVID, they've tried as best as they can to innovate.
What do you make of the COVID-19 response on the continent?
Overall, I have to say that I'm proud of African leaders because very early on, they've taken action. Ghana pulled testing to preserve real resources so that they can do it in a very smart way, given their means. Nigeria, the entire private sector, coming up with an initiative to put money aside so that they can help the officials fight with it. So a lot of different things have been done. South Africa, where you have chronically ill patients of HIV and TB, although the impact is still very high. 80+% of our populations here are in the informal sector. So, and this is what I always tell my colleagues, that what they've had to do is to deal with what we call the trade-off triangle. Fighting the pandemic, fighting the economic pressures where it's about deciding between life and livelihood, and then keeping essential services, because that was also the problem, is that when I talk about the setbacks, right? So we talked about essential services. I talked about immunization. So a lot of the things that were done to get some gain in health, they've basically been wiped out.
The world is trying its best, but COVID-19 is still affecting people globally. So what is there that needs to be done to really have concrete results for Africa specifically?
So the first thing is that COVID response, as we see it, cannot be a one-country response. What is needed is a global concerted effort to look at the problem holistically, knowing that even those who are rushing to solve just their country's problem, there are limitations to that as well. So this is one of those situations where we all join by the hips. And long-term or medium-term, it will be very difficult to take care of this if you do not have a vaccine that stops it. And to get to that level, there has to be situations where distribution should be made, not according to who can afford it, according to who actually needs it, including health workers, et cetera, et cetera. You have to look at the world in one big space where you have that consultation. Those who can really afford it should be willing to actually contribute to it in a meaningful way. And the pharmaceuticals companies need to be willing to make it available at an affordable price. So consultation, those who can afford it to contribute more to it, and then those who are making it, make it affordable. Because yes, there is a human side to going that way, but there is also a fundamental side that basically looks at reality, because this is something that you cannot look at in isolation.
Sheikh Oumar Seydi, thank you so much. We appreciate your time.
Thank you very much for having me.